Imagine getting hit with a $10,000 compliance fine just because a billing clerk, 5,000 miles away, clicked the wrong drop-down menu. Or like a patient walks into your waiting room with a severe surgical infection and they have zero medical records because they bought a discount medical vacation on Instagram.
Right. I mean, that is the reality of a globalized healthcare market now. For physician-owned SMB clinics, the borders are basically gone. Everyone is looking for a bargain.
Completely gone. And the hidden costs of those bargains are definitely starting to surface,
Yeah.
which is exactly what we're digging into for you today on this deep dive.
Yeah, we're synthesizing some really diverse sources to look at how this push for cost cutting is creating massive operational traps for small and medium-sized practices.
So we're looking at both when clinics try to outsource their back office and when patients kind of, outsource their own bodies. Let's start with the clinics. Shrinking margins are forcing independent physicians to cut overhead, right? Which usually points them straight toward offshore medical billing.
Oh, absolutely. I mean, the hourly rate looks fantastic on a spreadsheet, but a study by Kiwai Attack actually mapped out what happens when you offshore medical coding.
And it's not great, I'm guessing.
Not at all. The nuance of U.S. medical records, like understanding the specific clinical context, it often gets lost in translation. And that disconnect leads directly to higher claim denial rates.
Oh, because the offshore coders aren't catching the specific modifiers or details needed to justify the claim to a U.S. payer.
Precisely. The study showed this causes an average drop of 0.1 in a hospital or clinic's case mix index.
Wait, a zero point 0.1 drop. So just to clarify for everyone, the case mix index is basically the metric that reflects how complex and resource intensive your patients are. Higher complexity means higher reimbursement.
Yes, exactly. So a drop like that means your coding makes your patients look, well, less sick than they actually are. In this study, that documentation gap cost an average of $4,500 per inpatient encounter.
Oh, wow. That completely wipes out whatever money you saved on cheaper labor. But let me ask you about the liability side. Okay, let's unpack this. Outsourcing billing without a tight contract is like handing someone your wallet and paying them to lose your credit cards.
That's a great way to put it.
Wait, if the third-party vendor messes up the claims or data, isn't the vendor legally on the hook?
You'd think so. But a legal review by Day Pitney looked into these vendor contracts, and the short answer is no. A lot of these offshore agreements have really broad disclaimers.
So the clinic just eats the cost.
Yep. Unless your clinic secures mutual indemnification, meaning the vendor contractually agrees to pay for any losses they cause, the clinic absorbs the damage.
That is wild.
Yeah, and if there isn't a strict business associate agreement, or BAA, governing HIPS compliance, the clinic pays for the payer audits and data breaches.
Which the sources show can hit 10 grand per violation. But, clinics aren't the only ones looking for a shortcut. Patients are doing the exact same thing with medical tourism.
Oh, definitely. They see an all-inclusive package in Turkey, the VIP airport transfer and a five-star hotel.
Right, but it creates a dangerous facade. Those luxury packages often mask unaccredited surgical centers, don't they?
Exactly. They frequently rely on unlicensed technicians to perform the actual procedures, especially in high-volume areas like hair transplants or cosmetic dentistry.
And the sources point out a massive red flag here. Board-certified surgeons aren't actually allowed to offer coupons for surgery. It commodifies care in a way that violates medical board standards.
It does. Yet patients buy the package anyway, fly home with complications, and the local physician-owned clinic is left trying to fix an infection with absolutely no chart history.
They are flying blind to what was injected or implanted. But let me offer some pushback here, based on the sources. There's a powerful financial mechanism driving this, right? Like for a self-funded employer, choosing a $20,000 hip replacement in Finland over a $40,000 one locally keeps them under their stop-loss insurance deductible.
Yeah, that's the financial cap where their catastrophic policy kicks in to cover the rest.
Exactly. Isn't this a highly competitive threat to local clinics? How do they even fight that?
It's a huge threat. But local clinics can't win a price war, so they have to pivot to proving their quality. That means loudly marketing their AAA accreditation.
Which proves they meet rigorous hospital-level safety standards. But how do you prove that safety actually translates to better outcomes for the patient?
By utilizing provider ranking systems, or PRS. And this isn't just a consumer review site with star ratings?
Right. It uses hard data to track longitudinal outcomes, procedure-level experience, things like that over time.
Exactly. A local clinic uses this data to show that their hip replacements result in fewer readmissions and faster recovery times than the cheaper alternatives. You leverage the data to prove you are the most clinically efficient choice.
So what does this all mean for you? It's about building a defensive moat with data and compliance.
Well said. And a quick note from the sources, as international care grows, local clinics handling any cross-border payments have to use compliant international platforms to avoid anti-money laundering flags and build patient trust.
Absolutely vital. So to wrap up our deep dive, we've seen how offshoring back-office tasks can bleed revenue through poor coding, and how cheap medical tourism threatens local patient retention.
It's a tricky landscape for sure.
It is. But here's a final thought for you to mull over. As these healthcare borders continue to blur, could local physician-owned SMB clinics eventually stop fighting medical tourism and instead partner with those overseas hospitals?
Oh, that's an interesting angle.
Imagine a model where your local clinic handles the lucrative pre-op diagnostics and post-op care locally while the main procedure happens abroad. We'll leave you to think on that. Thanks for joining us on this deep dive.